Today we're going to be answering the top 6 questions we get DM'd about Ozempic and semaglutide.
So we get a lot of questions DM'd all the time. So Dr. Ryan, question number one, how does semaglutide Ozempic work?
So semaglutide is the main ingredient in Ozempic and Wegovy. Semaglutide essentially is a GLP agonist. It's a hormone that's naturally produced by our body whenever we eat, and it helps regulate appetite and blood sugar levels. GLP-1 increases insulin secretion so that we can use up glucose, and it decreases our glucagon release so that we don't send more glucose to the bloodstream. It also delays the rate that our stomach gets rid of food and decreases hunger hormones in the brain. And our body essentially responds the same way to semaglutide as it would to the GLP-1 hormone.
Okay, so it mimics, okay, so semaglutide works by mimicking GLP-1, a hormone that regulates appetite and blood sugar levels, means you'll feel less hungry, okay, which helps reduce caloric intake and supports weight loss. All right, interesting. So question number two, why is semaglutide so effective for weight loss?
Well, the key thing is that it makes you feel fuller, and this is how it helps reduce food noise as well as cravings. And when you are able to accomplish this, you can stay in a calorie deficit much easier.
It also helps you manage emotions without turning to food.
That's true. That's true.
And question number three, why is semaglutide so effective for diabetes?
So, very simply, diabetes is a disease caused by too much glucose in your bloodstream. And insulin is a hormone that transfers glucose out of the bloodstream into your cells. And semaglutide tells your body to release more insulin from the beta cells of the pancreas and tells your body not to release as much glucose in the bloodstream. And it makes you digest your foods a lot slower so you don't release glucose into your bloodstream quite as fast. The best way I like to look at it is semaglutide is a good jumpstart. It's an easy way for you to get back into the process of eating healthier and avoiding certain foods and starting your process of weight loss. And then we can transition to other ways to help you have a more healthy relationship with food and manage your lifestyle and diet.
Yeah, so you really don't have to be on semaglutide forever, right? It's just kind of a catalyst jumpstart for weight loss. You can manage your lifestyle with healthy food choices, habits, and sustain your gains, provided you do the right nutrition and workouts and habits to you, for you, right? So that's something that we've noticed in our client base of a few thousand or so. And so it leads me to my next question. Question four, how do I overcome my fear of injections?
So this is a really common concern. I think a lot of people have a bad experience with needles, maybe when they were kids going to the pediatrician office and getting a vaccination. And I fully understand that. But it is really, and this is easy for me as a physician to say to a patient, it's really not that bad, but it really is not. We use very small needles. Typically, needle sizes are measured in gauges. So 30 or 31 gauge is a pretty small needle. And it's a very short needle. It's typically between a ½ inch to 5/16 of an inch. With the right syringe and the right needle, it's virtually painless. It will take you a couple of tries to get comfortable, and that's okay. But typically, within the first 2 or 3 injections, the vast majority of my patients are able to get it done very easily. All you have to do is make sure to use sterile technique when you're doing your injections, so wiping off the vial, wiping off the site with an alcohol pad, drawing up the medication, and of course, injecting yourself. But it really is not a big deal at all.
Yeah, it's funny, Dr. Ryan. Just don't be afraid of injections. And I was guilty of that, I think, super afraid. And so I had to have my significant other inject me for my first 10. But to Dr. Ryan's point, with the right syringe, it's painless, right? It took me probably 10 or so shots to feel comfortable. And the needle is a little bit to overcome, but when you're actually doing the shot and having someone help you set yourself up, I thought myself, hey, just doing it and going for it, because you have a serious opportunity to change your life, right? By starting a medication like this, worth it, right? And I wish I could kind of even explain to some of our viewers that the fears of injections or small amount of side effects are kind of maybe worth it once you start to see the results of weight loss or the benefits of semaglutide. And I feel like a lot of people are so terrified of the side effects that when there's a chance you may not even get them. And we're going to tell you exactly how to reduce the side effects, which leads to my next question, Dr. Ryan. Question number 5, why is it so hard for primary care doctors to prescribe semaglutide?
So semaglutide right now, for individuals that want to get covered by insurance, it can be quite the tricky situation because it requires specific criteria. So typically there's a BMI, your body mass index, that has to be above 30. The way in which you calculate it is you take your weight in kilograms and divide by your height in meters squared, and you get a number, and that number has to be 30 for it to be covered by insurance, and 27 if you have another medical condition like diabetes or high blood pressure or high triglyceride levels. And so for a lot of people, they don't necessarily meet that criteria. And then for the people that do meet that criteria, which there are quite a few, of course, there are nationwide shortages. And you may have the script, but you might be going to like a Walgreens or a CVS or any other pharmacy, and they may not have the either the amount of semaglutide that you desire, like 1 or 2 to 1 milligram or 0.5 milligram syringes, or they may not have it at all, period.
I can't tell you, Dr. Ryan, from all the intakes, like how many clients went to our primary care physician. They were super excited and helpful about getting this drug. They've heard so many good things about to lose weight and control the food noise in there. But in my case, and this is a personal case as well, like my primary care doctor said no, like most typically do. I'm not going to prescribe that. Be my rules, and certain conditions are required. And she also mentioned it's getting harder and harder to get insurance to cover it. So even if it did get prescribed, to your point, once you approach your goal rate, insurance may stop coverage. That's what some of our clients told us. And even if you get approved by insurance and a prescription, you may not get it for weeks or months, right? Because there's these shortages today. That's where our Lean Fast, our RX program comes in. We help you navigate these challenges and make the process easier for you. We have next day shipping. We have nationwide delivery, along with a fitness and a health coaching app that helps you keep the weight off and build healthy habits and accountability to ensure you'll get to where you want to be.
Yeah, resistance training as well as following a diet that has an adequate amount of lean protein is really key in reducing the amount of skeletal muscle mass you lose while on the drug. So we really emphasize those things.
Which leads to my next question, Dr. Ryan, which we get all the time. Question number 6, how do we minimize side effects of semaglutide?
So I'm really going to focus on the main side effects I see with semaglutide when I answer this question. And these include things like nausea, vomiting, diarrhea and constipation, and heartburn. And this could be a much longer answer, but the very simple answer is by using lower dose. Microdosing the medication in 2 to 3 weekly microdoses is key, and that will really help reduce the amount of side effects because you're getting a smaller amount delivered in to your body. And this is a little bit different than the traditional way of injecting, which is once weekly, but I found with a lot of patients who couldn't tolerate the large dose once weekly, when we broke it up into 2 doses, they were able to have a much better experience with semaglutide. And many times, the biggest issue I see is nausea and heartburn. Those 2 things tended to go away.
Yeah, the key is finding the right medical provider to kind of find the right microdose for you, right? And if it's 2 to 3 times, the benefit of microdosing is kind of zeroing out the side effects, but maximizing benefit. And so we help these answers help you feel more confident about starting with GLP-1 medication or semaglutide. If you have any more questions, leave a comment below, and thanks for watching.